Hello, good afternoon, good evening, good morning, depending what time you're going to come across this video. I'm here and I'm bringing you something called Vital Signs. Now, it is important to always check your vital signs always, even if it's once a day or once or twice in a week to make sure that you're in a correct shape. So I'm going to tell you just the abnormal reading and the normal reading of each of these vital signs. So if we talk about the blood pressure, we have a normal blood pressure that goes from 120 systolic to 80 diastolic, which is fine. And then we have an abnormal reading, which is hypertensive, anything that is above 180 systolic to 120 diastolic. Then we have the average ones that goes between 122 to 129 systolic to 80 diastolic. And then we have this thing that goes towards the hypertensive way, which is between 130 to 139 systolic and 114 and above, which is towards the hypertensive way. Then we talk about the pulse as well. The pulse, we have three types. We have the normal, we have the tachycardia, and we have the bradycardia. So the normal goes between 60 to 100, which is perfectly normal. And then when we talk about the tachycardia, we talk anything that is above 100. And then when we talk about anything that has to do with the bradycardia, so brady, so it's less than 60. So just be aware of that. And then we have the temperature. We have the normal, we have the hypothermia and hyperthermia. So the normal goes between 36.5 to 37.2. And then we have this thing called the hypothermia that goes to 35 degrees Celsius. And then we have this hyperthermia that goes to 40, 40 and above. Now, mind you that if you have any temperature that goes up to that 40, that means you need to check for any signs of infection. So now, if you're working in a hospital in any kind of hospital environment, 40 is one of the first signs of early infection. So in this case, you can check they can do a blood culture to see where the signs of infection is coming anyways. And then we go to a respiratory rate. Then there we also have three types of respiratory rate: normal, tachypnea, and bradypnea. So the normal goes from 12 to 20, and then brady is anything that is below 12, and tachypnea is anything that goes above. And then we have saturation level in your body. Now we know that normal saturation oxygen in your body is 94 to 100%. Now we know that we have also a low oxygen. Now the difference here is that if you are having a saturation level inside you between 94 to 100, which is normal. But if you're having below the 94, which is 88 to 92, it's also normal only if you have this symptoms or you have this well-known asthma or chronic COPD, so chronic obstructions. Um, if you have it, then of course 88 to 92 is acceptable. But if you are not known for that, then you need to be worried about that. You need to get checked about that. You'll be required some oxygen to boost up your oxygen level. So that's all for me for today. I bring you this vital signs. I hope you have learned something. If you have learned something, please click the like button and share this so it can go viral for those people that don't know about the normal and abnormal readings of all these vital signs. Remain blessed. I love you all. Please don't forget to like my page and share it. Thank you. Bye bye.